I'm Asma Banu. I work as a medical doctor in Om Hospital and Research Center in Kathmandu, Nepal. Since Nepal has a limited number of competent embryologists and Merck was providing this 3-month training program, I was one of the participants who got selected to represent Nepal. According to a recent study done in Nepal, 15% of married couples were infertile, out of which more than 40% were having the cause factor from the male side. But of course, Nepal still being a male-dominated country, the women are still blamed. Women are discriminated and sometimes even socially outcast from the family. Instead of finding solutions to the problems, the males would rather remarry or just leave the wife. The 3 months of training provided by Merck Foundation in partnership with Morula IVF has been a very valuable learning experience for me. It not only focused on embryology, but it started with the basics like even semen analysis and everything that goes on in the andrology lab. Since there are very few courses offered with this hands-on practice, it has been a very wonderful experience, and I hope to be able to continue the same back in my country. Merck Foundation, with its campaign in partnership with Morula IVF, is creating history in Asia, especially in Nepal, because of its program to provide competent embryologists. And in doing so, they will be providing accessible healthcare and reproductive services accessible by all. Because prior to this, many people from Nepal who had the opportunity would still have to go out of the country for in vitro services and other reproductive services.
My name is Dilesh Ratmal. I am coming from the Sri Lankan Pioneer IVF Center, Vindana Reproductive Health Center. Merck Foundation, through the Merck More Than the Mother program, has enabled me to improve the knowledge to tackle the challenges of the infertility in Sri Lanka. As an ambassador of the Merck More Than the Mother campaign, I will be supporting the Merck to any of their following programs in the later. I value the exposure, knowledge and the skills gained from the embryology workshop from the Merck Foundation. I'm always preparing to give back the whatever I learned from there. I cannot grateful enough to Merck Foundations to providing me this opportunity to improve my skills, knowledge of infertility, to also be able to transfer knowledge in my country. So Sri Lankan will be better in overcoming infertility challenges.
First of all, I'm very excited to be able to host these 2 trainees to be able to learn more about becoming an expert in embryology, particularly and sharing our experience to our other Asian peers. We're very keen to and look forward for them to be able to implement what they've learned here over the past few weeks. And of course, Dilesh and Asma, having had some experience before and coming to the setting that we have already exposed them in Indonesia, this will be an opportunity for you guys to implement immediately when you come back home. And hopefully the learning curve that we've seen so far has been brilliant. And I congratulate both of you managing in such a tight schedule, but really hopefully quite a productive few weeks. And again, by the time that you come back to Nepal and Sri Lanka, this is something that you need to immediately expose yourself to, and again look forward to getting good results from your laboratories.